This is artwork by Emma Nanenja Stubbs. She's a researcher that we've been working with in Congress in Alice Springs, and it represents a study we've been doing with her, which is in English, Healthy Journey for Kids, but I'm going to read it out in Aranda, and I apologise to anyone who speaks in Aranda. It's Achepa, Iwara, Ampaka, so Healthy Journey for Children. This is Emma's words, which I'm reading out to you about this, and I can't talk about the context of people's lives any better than Emma has. This painting tells the story about growing up strong and healthy in Mbantwe, including the importance of secure attachment with caregivers, access to education, access to shelter, feeling safe to be able to grow your family through community support and connection. There are elements of Mbantwe that I've included to demonstrate the important role that culture and our Dreamtime stories play in shaping our future and identity for our little ones by building strong and resilient families. You will see the Yeparinya, the Nachalika, and the Unut Ungach, I knew that one would get me, who are beings of great significance for the Aranda people. Also, there are the paw prints of the wild dog that protected the entrance into the Mbantwe. Another important element to this painting shows the many riverbeds that connect Mbantwe to this land. Mbantwe is the traditional name for the township area, which means watering place, and it references a waterhole in the Todd River at the old telegraph station. And you can see, I don't think I could really have said this any better than Emma has, and in this magnificent painting, which we have permission to show today. So I might get my population health colleagues to come up here. This is our slightly less artistic version of exactly that, talking about the socio-ecological model of health, really, understanding children live in families, families live in communities, communities need services, and services need policies. And so what we're going to do with you this morning, I took really serious the challenge of how we might make this interesting and entertaining. And there are various views on how people feel about green t-shirts right now. But I couldn't possibly talk to you about what was happening in population health without really showing you the extraordinary breadth of what we do and the extraordinary science, but more importantly, the extraordinary people who make up the researchers in this organisation. So they're going to share you, this is like a degustation of population health. Like all degustations, take as many photos as you like. However, don't clap till the end, because this is a highly timed exercise. And the other is you'll see the stream through this is mental health, because as you all know, this is a major issue. And then following that, this is the last slide that I have. This is from the James Webb Telescope. And it's really the idea of how do we build the data infrastructure that's going to provide data for all of you and for researchers around the world into the future, so that, as you can see, a world that centres on prevention, early intervention and equitable care for children, in fact, where children thrive. And we're going to be talking about Gen V and Life Course as the epicentre of that. But now I'm going to hand over to the extraordinary population health.
Thanks, Sharon. Good morning, everyone. My name's Simone Darling. I'm a Senior Research Fellow and Team Leader in the Policy and Equity Group. Our mission is for all children to live a mentally healthy and fulfilled life, and we achieve that mission by working in true partnership with children in the places where they live, learn and play. By taking a prevention, promotion and early intervention approach, we have the opportunity to work with parents, schools and educators, communities, healthcare professionals and policymakers to ensure that children have the best foundation to develop positive mental health. Nearly all children attend school. That's why one of our major focuses is on building the capacity of schools to support children. In partnership with the University of Melbourne, we developed an innovative model of care to build the capacity of schools to support their student mental health and wellbeing. We co-designed and piloted that innovative model, and our pilot showed that the model increased the confidence of educators to support their students, increased the mental health literacy of parents and teachers, and increased the mental health outcomes, positive mental health outcomes for students. In 2022, the Victorian Government invested a historic $200 million to expand this model to every Victorian primary school by 2026, positively impacting more than 550,000 students and 25,000 teachers. Thank you.
Good morning, Good morning, everyone. My name is Sonia Khano, and I am representing the Health Services Group. In the northwestern Melbourne catchment alone, there are 561 general practice clinics, 2,500 GPs, and 1,300 mental health community service providers. So how do children access and use these services? How do we deliver high quality care, and how much does it cost the government and families? These are the questions we ask. We conduct health service research in metro, regional and rural areas by evaluating models that keep children out of hospitals, reduce low-value care and improve access to mental health services with the hope to better inform policymakers. As part of this, we work with GPs, paediatricians, mental health professionals, and allied health. At the Royal Children's Hospital, 60% of emergency presentations are for low urgency conditions that could be treated in the community. However, GPs say that they lack the support and training to manage many paediatric conditions, including mental health. To address this, we have integrated paediatricians in general practice, where GPs learn directly from them in consultation with patients. In the mental health space, we created an online community of practice where community clinicians are supported by a child psychiatrist covering topics such as anxiety and depression. We found that this significantly improved their confidence in how to assess and manage their patients, and it reduced their burnout and isolation. Due to these results, we are now a finalist in the 2023 Victorian Public Healthcare Awards. Thank you.
Hi, I'm Kirsten Perrett, Group Leader of Population Allergy. Raise your hand if you or someone you know has an allergy. Australia is the allergy capital of the world, with more than 5 million Australians living with allergic disease. We also have the highest rates of childhood food allergy globally, with 1 in 10 infants having a food allergy. Currently, there is no treatments available for food allergy in routine care, so management relies on strict avoidance of allergens. For children and adolescents, this can cause significant mental health ramifications, from social isolation to schoolyard bullying and other things that I'll tell you about very soon. Food avoidance and disordered eating. And for parents and carers, there can be anxiety and depression or post-traumatic stress following a severe reaction like anaphylaxis. As you have just seen, allergy touches many of us. Our group wants to change the trajectory of childhood food allergy before starting school and identify evidence to inform the best care so that children and young people living with allergies can stay healthy and keep safe. Our clinical trials and cohort studies program is identifying and testing the best new strategies to prevent, treat and manage food allergy, and we encompass all facets of this model jigsaw. Since 2007, we have enrolled over 21,300 participants across 15 studies investigating 12 allergens. The life-changing impact of our research is evident in Ryan's story, a patient of mine. In November 2021, he came and saw me at the Children's Hospital with walnut and cashew allergies. And after just 22 months being involved in our multi-nut oral immunotherapy treatment program, he is now cashew and walnut allergies are in remission. Thanks to our National Allergy Centre of Excellence, funded by the Australian Government last year, We are also building the tools and resources not only to accelerate and facilitate food allergy research, but now across insect, drug and respiratory allergies. Our national plan of action includes embedding studies and registries into routine clinical care, developing living systematic reviews, and training the next generation of allergy researchers. Our Centre for Food and Allergy Research, funded since 2013, specifically focuses on food allergy. And it's enabled our brightest minds to interrogate our data and our biospecimens for discovery and impact. If you have allergies or you look after patients with allergies, please join us. Thank you.
Hi, I'm Valerie Sung, Team Leader of Prevention Innovation. Our group's vision seeks fast solutions to reduce the impacts of today's common childhood conditions using flexible, multi-use, observational and trial platforms that measure multiple child health domains. One of our team's visions is to ensure each deaf or hard of hearing child born in Australia has equitable access to the best interventions and services. Hearing loss is the most common condition screened at birth, affecting 3 in 1,000 babies. Our Victorian Infant Hearing Screening Program screens more than 97% of the 80,000 babies born in 65 Victorian maternity hospitals, allowing early diagnosis and access to intervention. Despite early detection, many deaf and hard of hearing children face challenges as they grow up in their development, their learning, their physical and mental health and well-being. To address this, we built the VicChild Research Platform, and we have been collecting child outcomes for more than 1,200 deaf and hard of hearing children and their families. And this is one of the world's largest child hearing research cohorts. Now we're partnering with children, families, child hearing health stakeholders around Australia to develop a national database linking data sets from multiple states. And we're going to be using this to address sustainably and systematically measure outcomes of these children and for outcomes that matter to all these families. Our vision and hope is for every deaf and hard of hearing child in Australia to access the best start to life and achieve the best potential. Thank you.
Hi, I'm Nandi Vijaykumar, a Senior Research Fellow at the Centre for Adolescent Health. We are a WHO collaborating centre working extensively on global adolescent health, and supporting young people's mental health and well-being is central to our efforts. Now, adolescence is a period of really important life transitions. It's one of dynamic growth, but also when many vulnerabilities first surface, with up to 40% of young people facing unmet mental health needs. This really highlights a pressing challenge for our society that requires investment across the continuum of care, from prevention to treatment to continuing care. One second. We lead several long-running longitudinal cohorts that are informing our understanding of the burden of persistent and chronic mental health problems in society. 2 of these are the longest running in Australia. One started in 1983 and the other in 1992. And we're now following the 2nd and 3rd generation of families so we can better understand how to break intergenerational cycles of risk. Now, we focus on the everyday things that influence mental health strengths and difficulties, and work with government to monitor their impact on young people, like social media, COVID-19, even climate anxiety, and the current cost of living and housing crises. We also have strong ties to the Commonwealth Government and the state government, and we work with the Department of Education and Health to inform prevention and health promotion efforts. We particularly support parents and teachers, but also communities more broadly during periods of transition, like when children move from primary to secondary school, but also onto young adulthood and beyond. And finally, we believe in the importance of incorporating a youth voice to our work. So we established the CREATE group of youth advocates as part of our Centre for Research Excellence in order to make sure that our research is meaningful for the current generation of young people. Thank you.
Hello everyone, I'm Stephanie Brown and I'm here representing Intergenerational Health. At a little bit of short notice, so please bear with me. My colleague Deirdre Gartland is flat on her back in bed. Our group aspires to a more equitable and socially inclusive world where children, families and communities experience belonging, safety and opportunities for growth. By the time that children turn 10, 1 in 3 Australian children are going to primary school having come from homes where family violence has been occurring between their caregivers. Children who are exposed to family violence have 2 to 3 times the odds of experiencing a psychiatric diagnosis, but by the time they turn 10. The good news, as we actually saw this morning in the Welcome to Country, is that children who experience strengths and resources in their families, in their communities, and in their schools are actually much less likely to have poor mental health, even when they experience social adversity and family violence. Our research program, designed with the communities we work with and with partner organisations, works to break cycles of intergenerational trauma and family violence and increase the capacity of health and social care services to both identify trauma and to respond in ways that break cycles of intergenerational trauma and social inequity. Resilience is a major focus of this work, and when I use that term resilience, what I'm talking about is the processes that enable children exposed to social adversity to grow up with that sense of belonging, with well-being and with opportunities for growth. Our group has the privilege, the very real privilege, of working with Aboriginal and Torres Strait Islander children and families, and with families and communities of refugee background, and the partner organisations that know those communities very well, to both co-design, plan, implement and translate research into practice. We've developed socially inclusive tools for measuring resilience in children and in adults, and those tools are now being used by clinicians, by researchers, other researchers, and by health organisations both within Australia and internationally. The goal of this work is to support the social and emotional well-being of, first and foremost, Aboriginal and Torres Strait Islander children, but also to support all children, families and communities to experience safety, belonging and opportunities for growth. Thank you.
Hello, everybody. My name is Lindsay Pearce. I'm a research associate in the Justice Health Group that's part of the Centre for Adolescent Health. Children and adolescents in contact with Australia's youth justice system experience profound health and social inequity. Nearly every health issue is overrepresented in this population. Our team studied 50,000 young people in contact with the youth justice system in Queensland. We found that they're over 4 times more likely to die than their peers in the general community with no youth justice contact. Furthermore, they're over 7 times more likely to die from drug-related causes. 1/3 of all deaths in this population were due to suicide. Youth justice contact is an adverse childhood experience and is just one marker of disadvantage among the many others that are common in this group of young people. Many justice-involved young people also experience homelessness, poverty, school dropout, child protective services contact, incarceration of a parent or caregiver, and other intergenerational traumas. Youth justice contact is an unfortunate but critical opportunity to identify vulnerable young people and better support their health needs. It's also an opportunity to close the gap on Aboriginal and Torres Strait Islander health. In Australia, Indigenous young people are 24 times more likely to be incarcerated than non-Indigenous young people. When we consider just kids aged 10 to 13, this number balloons to over 50. Our group's objective is to fill widespread evidence gaps on the health and social needs of this vulnerable population. We are using this evidence to better help justice, health, police, child welfare, education, and other systems make better decisions and work together to support their health needs.
Hello, everyone. I am Ghazaleh Dashti. I'm a senior research officer at the Clinical Epidemiology and Biostatistics Unit, also known as CBU by many. Biostatistics is the foundation of applying statistics in health and medical research. Without input from biostatisticians, research often lacks a clearly defined question, or it may have an inappropriate design, and both of these undermine research quality. Also, without biostatistical knowledge, researchers usually do their data analysis without considering whether the used approach is appropriate for the research question of interest. And unfortunately, this usually leads to wrong findings and wasting research efforts. At CBU, we are a group of 34 people. 27 of us have biostatistical expertise, which is pretty unique. We strive to be a hub of excellence in biostatistical methodology, and we take pride in that. We work extensively with collaborators across Melbourne's Children campus. We train and upskill biostatisticians and researchers at a range of their career stages. But importantly, we also do our own research. We develop and evaluate cutting-edge biostatistical methodology. And without these methods, some of the most important questions our collaborators have cannot be addressed. Like give you an example, our group has recently developed a method to help directly evaluate the impact of interventions on causal pathways to disease to prevent ill health. The method has already been applied in over 10 studies, leading to powerful new knowledge about interventions to reduce mental health disorders in children and their families, but also cancer, cardiovascular diseases, and allergic disorders, just to give you a few examples. Now, I hope you can see that our research is both informed by, but also underpins the quality and impact of the research that our collaborators do. What we really hope to achieve is to enable the research that informs the ecological model you have seen and you've heard about to be conducted with the highest methodological quality and integrity.
Thank you. It is so lovely to see literally everyone today. I'm Meredith O'Connor, and I'm a Senior Research Fellow and Program Lead with the Melbourne Children's Life Course Initiative. When COVID-19 hit, we were able to rapidly take the pulse on what over 9,000 children and young people were thinking and feeling. This allowed us to speak in a united voice about the urgent need to support children's mental health. This was made possible by our collaboration of 23 internationally significant top-tier longitudinal studies, some of which we've heard mentioned already. Mental health is a journey that unfolds over a lifetime. It's not a snapshot in time. What makes these studies so special is that they've followed children's mental health as they grow and as they develop over years and indeed sometimes even decades of their development. The Melbourne Children's Life Course Initiative brings together these precious data gems. We provide researchers with a gateway to these data, ensuring that what are truly national treasures can be used to maximum advantage. Collaboration across these studies even further amplifies their value and impact. Together, they offer us a panoramic view across all aspects of the ecological model, allowing us to grapple with the complex influences on children's mental health across the contexts in which they live, work, play, and grow. By uniting our efforts, we're generating the robust and precise evidence that's needed to strengthen policy, improve service delivery, and ultimately give all children the opportunity to thrive and live a healthy and fulfilled life.
Good clap. Check it out. That was pretty good value degustation, I reckon.